So if you're someone like me who thought dilaceration happens because दांत पे मुक्का मारा और बस टेढ़ा मेढ़ा हो गया, then this is for you. Let's understand the mechanism. So before we do so, what is dilaceration? Dilaceration is an abnormal angulation or a sharp curve in the root, or less frequently the crown of a tooth. So number one, this is an abnormal angle or a sharp curve which occurs in the root or less frequently the crown of the tooth. In these two images, you can see it has occurred in the crown. There is one portion of the crown and a portion of the root, and the remainder portion of the root has formed in an abnormal angle with a sharp curve. Again, you have crown and a portion of the root, whereas the remainder of the root has formed at an abnormal angulation. In this picture, we can see the same thing happening within the crown. So you have one portion of the crown and another portion of the crown in a different angle. Now this deformity can also be defined as a disturbance between the unmineralized and mineralized portions of the developing tooth germ. So this happens when the tooth germ is developing. There is some sort of a trauma that leads to displacement of the mineralized portion of the tooth, and then there is an angle difference between these two. Let's understand the mechanism here. This is a mechanical trauma to the primary predecessor tooth, which results in the dilaceration of the crown of the succedaneous permanent tooth. So in this, let's understand it with this diagram. Here we have the primary predecessor tooth, and this is the succedaneous permanent tooth. Up to 2 to 3 years of age, this succedaneous permanent tooth, it is in a palatal and superior position in comparison to the primary tooth. Now you can see in this diagram there is a vertical force that has occurred to the primary tooth. Now this force, it is passed on to the developing tooth germ through the incisal edge and the buccal portion of the developing tooth germ. So there is a vertically directed force to the primary tooth, and it passes along the buccal portion of the tooth to the undeveloped portion of the tooth germ. Now what happens? In the later part of the video, you can see that the entire crown portion along with the root has displaced in an upward direction within its follicle. So the developed portion of the tooth along with the developed portion of the root is displaced in an upward direction in the follicle. But now the remainder of the root that is to be formed by the Hertwig's epithelial root sheath, it's programmed to come in its normal position. So the rest of the root will be developed in its normal position, and this leads to an abnormal angulation between the crown of the tooth and the remainder root of the tooth. So again, summarizing, you have your primary predecessor tooth, you have your permanent succedaneous tooth. There is an impact towards the primary predecessor tooth which is passed on towards the succedaneous tooth. This causes it to displace in an upward direction within its follicle, leading to the remainder of the root to come in a normal position which is at a wrong angle to the succedaneous tooth. Now less frequently it can also occur because of adjacent anatomic structures, cyst, tumor, odontogenic hamartoma, odontoma, supernumerary tooth. Clinical consideration, because in this diagram it occurs in a mesial direction, it is easy to visualize. However, if it occurs in a facial or lingual direction, it may be more difficult to detect, and we may need different angulations of the X-ray to detect it. Also, these teeth tend to erupt late, so there is a delayed eruption of the permanent teeth, causing the primary tooth to be over-retained. This portion of the root may also cause a fenestration in the buccal or labial cortical plate. Coming to various treatment challenges, when you think of endo, you know that while doing the RCT of this tooth, it can cause a perforation. Number two, while doing an orthodontic treatment of the tooth, it is more susceptible to external root resorption. While doing an extraction, you might see that there is a root fracture of this portion. And while doing prosthodontic rehabilitation, you may see that this tooth is not a very good abutment and may need splinting with adjacent teeth to provide a multi-teeth support. Coming to final review questions, the term dilaceration refers to which of the following? So as we have learned, it is a deformity of a tooth consisting of a sharp bend in the root. So with this we come to the end of the video. I hope it helps you, and you can check out more videos in oral path on the channel. Good day.